Assalamu alaikum. So, dear students, in this lecture we will discuss about a medical condition known as celiac disease. Celiac disease is a condition, is a allergic condition, allergic to gliadin proteins present in corn and wheat. Basically, it's a gluten sensitive enteropathy. So, what is celiac disease? It is a gluten sensitive enteropathy. Patient is allergic to gliadin proteins. Gliadin proteins which are found in present in wheat and corn. These, when this patient take anyhow gliadin proteins or take wheat or corn, its immune system activate, and what these antibodies do, these antibodies will destroy the ciliary system of our GI. So in this patient, cilia will not be found if this patient take corn or wheat anyhow. So, or secondly, these are the patients which are having genes known as this disease is associated with HLA-DQ2 and patient having HLA-DQ8 genes. These genes, if patient anyhow have these genes present or activated, these will have allergic against the gliadin proteins, or can say gluten or wheat or corn. When the immune system activate, immune system will attack on the cilia and destroy them. These, so the GI tract will not have any cilia, so the motility function or absorptive function of these patient will lose, all the GI contact will lose, eliminate out of the body. So that patient will have diarrhea and steatorrhea, means there will not be absorption of any kind of vitamins, basically water soluble vitamins, headache. So what will be the symptoms of this patient? The main complaint of this patient will be diarrhea. Whenever he will take or she will take any wheat or corn, he will complain about diarrhea. The other features will be malnutrition due to steatorrhea, or can say loss of headache. Vitamin A, D, E and K, headache vitamins. Steatorrhea, and there is this patient will have a feature known as a skin allergic, known as dermatitis herpetiformis. Patient present with diarrhea and herpetiformis is a clinical sign of with celiac disease. The treatment of herpetiformis is also a treatment of leprosy, called a drug used in leprosy is dapsone, also used to treat dermatitis herpetiformis. Then now we'll discuss about the investigation. The first thing you should investigate are the presence of gene HLA-DQ2 or HLA-DQ8. The next investigation will be IgA and IgM antibodies. Which antibodies? Anti-tissue transglutaminase glutaminase antibodies. And the investigation of choice is the investigation of at these investigation of choice is IgM antibodies present. If these antibodies are present, then we can say this is a sign of this patient is celiac patient. And there are some other investigations which are anti gliadin protein antibodies and anti endomysial antibodies. So these are the investigation of celiac disease. You should only remember investigation of choice IgM antibodies positive. The complete name of IgM antibodies are IgM anti-tissue transglutaminase antibodies. Now let's discuss about the treatment. Treatment is very easy. Avoid the main cause. The only cause is wheat or corn. So gliadin or gluten free diet. There is an investigation also present known there is a investigation biopsy. In biopsy, when we take a sample, a piece of celiac patient, we found no celias. No cilia will be present, or antibody IgA, we found IgA antibodies found. This is a clinical sign of celiac body, but in some patient which truly follow the gluten-free diet, these patients will develop celiac in their GI tract and also have no IgA antibodies. So in this patient, how we will find that these patients are celiac patient or not? Other than these investigations, ask the patient to take gluten diet. Take gluten for 6 weeks. In some patient, if no celiac are found, or in some patients celiac are found and no anti-IgA antibodies are present, then we ask the patient to take gluten for at least 6 weeks and then repeat the biopsy. We found no celiac, then that will be the confirmatory test of celiac disease. Treatment is to avoid the cause, which is gluten-free diet, but some patients are not compliant to the gluten-free diet. In these patients are prone to T cell lymphoma. Complication of celiac disease is a complication. You should remember this as a MCQs, that complication of celiac disease is what? The patient which are not compliant, non-compliant patient will prone to T cell lymphoma. The main thing you should remember this, that the patient will have only two things. This patient present with diarrhea and dermatitis herpetiformis, and on investigation, on biopsy, you will find no cilia and IgA antibodies will be present. Then the confirmatory test to investigation of choice is IgM antibody, IgM anti-tissue tissue transglutaminase antibodies will be present. Then the treatment is to avoid the cause. We avoid corn and wheat, which is highly rich in gluten. And the complication of those patients which are not compliant to the treatment is T cell lymphoma.